Ever wonder what ADHD exactly is? It stands for Attention Deficit slash Hyperactivity Disorder, a widely recognized medical condition affecting both children and adults. It's characterized by difficulties with attention, impulse control, and hyperactivity. But did you know there are 3 types of ADHD? Predominantly inattentive presentation, predominantly hyperactive impulsive presentation, and combined presentation. Each type has unique symptoms and challenges, and it's not uncommon for the type to shift over time. ADHD is not a figment of the imagination or a result of bad parenting. It is a real diagnosable condition recognized by medical professionals worldwide. It's rooted in biology and often runs in families. Studies have shown that ADHD brains function and develop differently than those without the disorder, proving its legitimacy beyond any shadow of a doubt. So, ADHD is a real diagnosable disorder with varying types, not just a label for people who can't sit still. Now, who exactly gets ADHD? Let's dive into that. ADHD isn't exclusive to any particular group. It's a condition that spans across the globe, affecting people of all ages, genders, and ethnicities. While it's often diagnosed in childhood, it can continue into adulthood and in some cases may not be recognized until later in life. In terms of gender, there's a common misconception that ADHD is a boy's disorder. However, research shows that both boys and girls can be affected, though the symptoms might present differently, leading to potential underdiagnosis in girls. Geographically, ADHD is reported worldwide. It's not confined to any specific region or country. However, diagnosis rates can vary due to differences in healthcare systems and awareness of the disorder. So, there you have it. ADHD doesn't play favorites. It's not about where you live, how old you are, or your gender. So ADHD can affect anyone, anywhere, regardless of age or gender. But what causes ADHD? The answer is not as straightforward as we might like. ADHD, like many other conditions, is influenced by a variety of factors. Genetics play a significant role. Research has shown that individuals with a close biological relative with ADHD are more likely to have the disorder themselves. Environmental factors can also contribute. Exposure to certain toxins or substances during pregnancy, such as alcohol or tobacco, can increase the risk of a child developing ADHD. Additionally, there are neurological aspects to consider. Brain imaging studies have shown differences in the brain structure and activity of individuals with ADHD compared to those without. These differences can affect the way information is processed and how impulses are controlled. However, it's important to note that these factors do not work in isolation. They interact in complex ways, and it's this interplay that can lead to the development of ADHD. The causes of ADHD are complex and varied, often involving a combination of factors. How is ADHD diagnosed then? Well, the diagnosis of ADHD is not as straightforward as a simple blood test or a scan. There's no single test that can definitively tell if someone has this condition. Instead, it involves a comprehensive evaluation by a skilled medical professional, often a psychiatrist, psychologist, or pediatrician. These professionals use diagnostic criteria outlined by the American Psychiatric Association. The criteria focus on the presence of numerous symptoms like inattention, hyperactivity, and impulsivity that are inconsistent with the person's developmental level and directly interfere with their social and academic activities. It's also crucial to rule out other conditions that might cause similar symptoms. These might include learning disabilities, mood disorders, or even certain physical conditions. A diagnosis of ADHD can be a lengthy process, often involving detailed interviews, questionnaires, and observations about the person's behavior in different settings. So, to sum up, diagnosing ADHD requires a comprehensive evaluation by a qualified medical professional. What are the telltale signs of ADHD? ADHD, or Attention Deficit Hyperactivity Disorder, is characterized by a multitude of symptoms that can manifest differently in children and adults. In children, ADHD often presents as an inability to focus, impulsive behavior, or excessive activity. You might notice a child with ADHD having trouble following instructions, forgetting daily tasks, or frequently losing things. They may also have difficulty staying seated, wait their turn, or engage in activities quietly. In adults, ADHD symptoms can be more nuanced and are often mistaken for personality traits. Adults with ADHD may struggle with time management, organization, goal setting, and employment stability. They might have difficulty maintaining relationships, exhibit impulsive decision-making, or have low self-esteem. It's important to remember that these symptoms can also be indicative of other conditions or life circumstances. A professional diagnosis is always necessary. ADHD symptoms can vary greatly between individuals and across different age groups. How does ADHD affect one's daily life? It's a question we often hear, and the answer is multifaceted. So let's delve into it. At school, children with ADHD may struggle to focus on tasks, leading to inconsistent academic performance. They may also exhibit disruptive behavior, which can pose challenges for teachers and peers alike. In the workplace, adults with ADHD may face difficulties in maintaining productivity, meeting deadlines, and staying organized. This can potentially affect their career progression and job satisfaction. In terms of relationships, ADHD can cause misunderstandings and conflicts. The impulsivity and inattention associated with ADHD can make it difficult for individuals to fully engage in conversations or understand others' perspectives. Lastly, ADHD can also take a toll on mental health. People with ADHD are more likely to experience anxiety, depression, and low self-esteem. In conclusion, ADHD can significantly impact all areas of life, but with the right support, individuals with ADHD can thrive. Is ADHD treatable? That's an important question many are seeking answers to. The answer is yes, ADHD is treatable. While it's true that there's no definitive cure, there are effective ways to manage the symptoms. The primary treatment for ADHD often involves medication. Stimulant and non-stimulant medications can help to increase focus and reduce impulsivity. These medications are generally safe, but like all medicines, they can have side effects. Beyond medication, there's therapy. Cognitive behavioral therapy, or CBT, helps individuals develop skills to manage their symptoms. It can assist in improving focus, organization, and emotional regulation. Moreover, lifestyle changes can also make a significant difference. Regular exercise, a healthy diet, and good sleep hygiene can all help to reduce symptoms. Finally, there's support. A supportive environment at home, school, or work can greatly assist in managing ADHD. While there's no cure for ADHD, it can be effectively managed with a combination of treatments. How can parents support a child with ADHD? Understanding and supporting a child with ADHD can be a daunting task, but it certainly isn't impossible. One of the most crucial steps parents can take is to advocate for their child's needs. This means ensuring their child receives necessary accommodations at school and understanding their rights under the law. Creating a structured environment is another essential aspect of support. Children with ADHD often thrive in structured settings, so establishing clear routines and expectations can be immensely beneficial. This might involve regular schedules for meals, homework, playtime, and bedtime. Lastly, it's important to remember that every child has strengths. Encourage these strengths in your child, whether they're artistic talents, athletic abilities, or a knack for problem solving. This can boost their self-esteem and provide a positive outlet for their energy. In conclusion, a supportive environment at home can make a world of difference for a child with ADHD. It can help them manage their symptoms and lead a fulfilling, successful life. Can adults have ADHD too, you may ask? Well, the answer is a resounding yes. ADHD isn't confined to childhood. It can continue into adulthood and even be diagnosed for the first time in later life. In adults, ADHD symptoms might be slightly different from those in children. They might struggle with attention, have difficulty managing time, or find it hard to complete tasks. They might also exhibit impulsivity, like interrupting others or making hasty decisions. To diagnose ADHD in adults, healthcare professionals typically look at the person's history, focusing on their childhood behavior, and take into account the persistence of symptoms over time. Treatment for adult ADHD often includes a combination of medication, psychotherapy, and lifestyle changes, including diet and exercise. Cognitive behavioral therapy can also be particularly effective in helping adults manage their symptoms and improve their quality of life. So remember, ADHD isn't just a childhood disorder, many adults live with it too. Let's recap what we've learned about ADHD. We started with the basics, discovering that ADHD, or attention deficit/hyperactivity disorder, is a neurodevelopmental condition affecting both children and adults. We delved into who can get ADHD, learning it's not exclusive to a certain age or gender. We considered the causes, which remain somewhat elusive but seem to be a mix of genetic and environmental factors. We then moved on to the diagnostic process, which involves a thorough examination by a healthcare professional. We discussed the symptoms of ADHD, which vary but often include difficulty focusing, hyperactivity, and impulsivity. We explored how ADHD impacts daily life, affecting everything from schoolwork to relationships. We found out that ADHD is treatable, with a combination of medication, therapy, and lifestyle adjustments often proving effective. We also touched on how parents can support their child with ADHD, and that adults too can have this disorder. Understanding ADHD is the first step towards supporting those who live with it every day.